The House of Representatives is once again the epicenter of American political drama. This time, the spotlight is on a new budget proposal put forth by the GOP, which has sparked a wave of controversy and debate across the nation. The proposal, which aims to reshape the financial landscape of the country, has been met with both fervent support and staunch opposition. House Republicans, often heralded as champions of fiscal responsibility, have put forward a budget proposal that has ignited a firestorm of debate. Supporters argue that the plan is a necessary measure to curb government spending and reduce the national deficit. They believe that by tightening the purse strings, the country can pave the way for a more sustainable economic future. This bill, touted by some as a necessary step towards economic stability, is seen by others as a heartless attack on the most vulnerable members of our society. Critics argue that the proposed cuts to social programs will disproportionately affect low-income families, the elderly, and those with disabilities. They fear that the budget, if passed, will widen the gap between the rich and the poor, leaving many without essential services. At the heart of this contentious legislation lies a fundamental question: what are the priorities of our government? Is the primary goal to reduce the size of government, even if it means cutting back on programs that millions of Americans rely on? Or should the focus be on ensuring that everyone has access to basic necessities, even if it requires higher taxes on the wealthiest citizens? Is it about shrinking the size of government at all costs, even if it means slashing programs that millions of Americans rely on? The proposed budget includes significant cuts to healthcare, education, and social services, which has led to widespread concern among advocacy groups and citizens alike. Many are questioning whether these cuts are truly in the best interest of the nation, or is it about ensuring a basic safety net for those who need it most, even if it means asking those at the top to contribute a little more. The debate has brought to the forefront the issue of income inequality and the role of government in addressing it. As the nation watches closely, the outcome of this budget vote could have far-reaching implications for the future of American society. So what exactly is in this controversial budget proposal? The bill, championed by House GOP leadership, proposes significant tax cuts, primarily benefiting corporations and wealthy individuals. This move, they argue, will stimulate economic growth and lead to job creation. However, these tax cuts come at a steep price. To offset the revenue losses from the tax cuts, the bill proposes deep cuts to vital social programs, including Medicaid and SNAP, or Supplemental Nutrition Assistance Program. These cuts, critics argue, will have devastating consequences for millions of Americans who rely on these programs for their healthcare and food security. Medicaid, a program that provides healthcare coverage to low-income Americans, including children, pregnant women, the elderly, and people with disabilities, is facing the brunt of the proposed cuts. These cuts could force millions of vulnerable Americans to lose access to essential healthcare services. Imagine, if you will, a single mother working 2 minimum wage jobs, struggling to make ends meet. She relies on Medicaid to ensure her child gets regular checkups and necessary vaccinations. Now imagine the agonizing choices she would face if her child's healthcare was suddenly on the chopping block. The decision to vote for this budget proposal is not without its risks for House Republicans. Many of them represent districts where Medicaid and SNAP play a vital role in the lives of their constituents. Voting to cut these programs could alienate moderate voters and energize the Democratic base in the upcoming elections. As Representative Brendan Boyle aptly put it, any House Republican who votes for these Medicaid cuts is essentially signing their own political death warrant. Whether this prediction will hold true remains to be seen, but one thing is for sure: the political stakes are incredibly high. Adding another layer of complexity to this already contentious issue is the stark contrast between the budget priorities of the House and the Senate. While House Republicans seem determined to push through these deep cuts to social programs, Senate Republicans have expressed reservations about the potential political fallout. This inter-party divide highlights the deep ideological rifts within the Republican Party itself. It remains to be seen whether a compromise can be reached, or if this budget battle will further deepen the partisan gridlock that has come to characterize American politics. Section 6, Medicaid in the Crosshairs, a history of budgetary battles. The story of Medicaid is one of constant evolution and conflict, reflecting broader societal debates about the role of government in healthcare. The The current battle over Medicaid is merely the latest chapter in a long and contentious history. This vital program, responsible for providing health care to millions of Americans, has often found itself at the center of budgetary battles. Since its inception, Medicaid has been a lifeline for many, offering essential medical services to those who might otherwise go without. This program has been both lauded as a crucial safety net and demonized as a bloated government entitlement. From its inception as part of President Lyndon B. Johnson's Great Society programs in the 1960s, Medicaid was designed to provide health care to the nation's most vulnerable populations. Johnson's vision was to create a more equitable society, and Medicaid was a cornerstone of that vision. Over the decades, Medicaid has undergone numerous changes and expansions. One of the most significant changes came with the Affordable Care Act, signed by President Barack Obama in 2010. This legislation expanded Medicaid eligibility, allowing millions more Americans to access healthcare services. The expansion was hailed by many as a necessary step towards universal healthcare, providing a safety net for those in need. Community clinics and healthcare providers saw an influx of patients who could now receive care without the burden of insurmountable medical bills. However, not everyone viewed these changes positively. Critics argued that the expansion of Medicaid was an overreach of government power and a misuse of taxpayer dollars. They claimed that the program was rife with inefficiencies and fraud, and that it encouraged dependency on government assistance. The current debate over its future underscores the enduring tension between competing visions of the role of government in providing for its citizens. As policymakers and citizens continue to grapple with these issues, the future of Medicaid remains uncertain, reflecting the broader ideological battles that have shaped its history. Section 7. Beyond the Beltway: How Medicaid Cuts Could Impact States. While the budget battle plays out on the national stage, it's crucial to remember that the real-world consequences of Medicaid cuts will be felt most acutely at the state level. States, already grappling with tight budgets and growing healthcare needs, will be forced to make difficult choices if federal funding for Medicaid is significantly reduced. These choices could include cutting back on eligibility for the program, reducing benefits, or slashing provider reimbursement rates, all of which could have a devastating impact on access to healthcare for millions of Americans. Section 8. The Uninsured Crisis: A Ticking Time Bomb. The potential for a resurgence of the uninsured crisis looms large as Medicaid faces the chopping block. Millions of Americans gained health insurance coverage through the Affordable Care Act's expansion of Medicaid, and many fear that these gains could be reversed if the proposed cuts become a reality. A spike in the uninsured rate would not only have dire consequences for individuals and families struggling to afford health care, but could also place a significant strain on the entire healthcare system. Section 9. Conclusion: A budget battle with far-reaching consequences. The House GOP's proposed budget, with its deep cuts to Medicaid and other social programs, represents a stark vision of America's priorities. This budget proposal is not just a collection of numbers and financial projections, it is a statement of values and a reflection of what the party believes is essential for the country's future. The proposed cuts are extensive and would affect a wide range of services that many Americans depend on daily. While proponents argue that these cuts are necessary to rein in government spending and reduce the deficit, they believe that a leaner government will lead to a more efficient and prosperous nation. They argue that reducing the deficit is crucial for the long-term economic health of the country, and that tough decisions must be made now to avoid even more painful choices in the future. Critics counter that they will have devastating consequences for millions of Americans who rely on these programs for their well-being. They argue that the proposed cuts are not just numbers on a page, but real-life impacts on vulnerable populations, including the elderly, low-income families, and people with disabilities. These critics emphasize that the social safety net is a crucial part of the nation's fabric, providing essential support to those who need it most. As the budget battle rages on, the eyes of the nation are watching closely. News outlets are providing constant updates, and public opinion is sharply divided. The debate has sparked widespread discussion about the role of government, fiscal responsibility, and social justice. People from all walks of life are tuning in, eager to see how this conflict will unfold and what it will mean for their futures. The outcome of this fight will have far-reaching implications, not only for the millions of Americans directly affected by these programs, but also for the broader societal values we hold dear. It will influence how we view our collective responsibility to care for one another and the extent to which we are willing to support those in need through public funding. But also for the very soul of our nation and our commitment to caring for those most in need. This budget battle is more than a political struggle. It is a test of our national character and our willingness to stand by the principles of compassion and support for all citizens, especially the most vulnerable among us.